An infection in the middle ear occurs due to viruses, bacteria, or upper respiratory infections. These bacteria infract the backspace of the eardrum. Pain in one or both ears and fluid drainage are the symptoms of this disease. This infection usually elevates automatically, but sometimes severe infection could lead to many complications. Age, family history, and some diseases in children like Down syndrome are the risk factors for this infection. Let's explore this disease's main symptoms, accurate treatment, and precautions. What is meant by otitis media? An ear infection, otitis media, is an infection of the middle ear. This happens when any virus or bacteria reaches the Eustachian tube and leads to swallowing it or blocking its way. Ultimately, mucus gathers there, which prevents the fluid from running out and leads to a middle ear infection. What are the types of otitis media? The middle ear is affected by infection in many ways. These are acute otitis media, otitis media with effusion, and chronic otitis media with effusion. During acute otitis media, the middle ear suddenly got infected, which led to swelling and redness in the ear. Inside the ear, fluid is trapped. Its symptoms include fever and ear pain. During otitis media with effusion in the middle ear, mucus and fluid accumulate without infection. The affected person felt as if his ear was full. This condition occurs after the infection, which could last up to a month, leading to a loss in hearing capacity. Chronic otitis media with effusion. In this type of infection, the middle ear fluid remains for a long time or builds up repeatedly. Although there is no infection, it's hard to treat and could affect hearing. What is the main cause of otitis media? Some bacteria and viruses could cause otitis media. Mostly, middle ear infections occur due to another infection, such as a cold and upper respiratory infection. During a cold or other respiratory infection, the virus or bacteria moves to the middle ear by the Eustachian tube, a narrow tube between the middle ear and back to the nose. These germs block or swell this tube. When this tube is blocked, the mucus can't run out properly. As a result, the infection spreads out in the middle ear. The other cause of middle ear infection is the enlargement of adenoid tissue. An adenoid tissue is a patch of lymphoid tissue just back to the nasal cavity, responsible for preventing the passage of harmful bacteria. When this tissue enlarges, it blocks the Eustachian tube. Why do children get more otitis media than adults? Children's Eustachian tube is small and horizontal, which allows the bacteria or virus to pass down to the middle ear. Their adenoid tissue is also a large structure behind the nose, which could be inferred from the Eustachian tube. Due to these two reasons, the Eustachian tube swells and leads to a middle ear infection. Another reason is that the immune system or children's body's fighting system is under development and cannot resist the attack of bacteria and viruses. Therefore, infection in the middle ear happens easily. One of the main factors is that children easily adapt to the infection from other children in their group. What risk factors increase the chance of getting otitis media? The risk factors that may cause middle ear infections include age, family history, cold, chronic illness, smoky environment, and ethnicity. By considering age, we know that young children and infants have more chance of getting this infection. This disorder is genetic, so that it could run from parent to offspring. A cold can increase the chance of getting an ear infection. A middle ear infection is not contagious, but the children living in daycare or groups are more likely to be affected by otitis media. If a child has a cleft palate, it means he has a congenital disability and has more chance of getting otitis media. Congenital disability is a condition in which children's mouth roof has a split. A person having Down syndrome, a condition in which he has a learning disability, would be greatly affected by otitis media or a middle ear infection. What are the symptoms of otitis media? Here are the symptoms that an adult experiences during middle ear infection: feeling like the ear is full of fluid, an irritation around the earth, pain deep in the earth, feeling sickness, problems in hearing, fluid discharge, throat soaring, energy down. Children face different symptoms as compared to adults, which include pain in the ear, especially at sleeping time, problem in hearing or response to any sound, temperature above 38 degrees Celsius, fluid drainage from the earth, more crying, less feeding, pulling an ear, headache. How is otitis media diagnosed? If you are getting an infection, visit your doctor. You have to take a physical exam of the ear, in which the doctor uses an otoscope to see the eardrum. An otoscope is a small instrument, just like a small flashlight. Sometimes, the examiner may take tests of children's ears, like tympanometry, acoustic reflectometry, tympanocentesis, and hearing tests. How is otitis media treated? The treatment depends on many factors, including the children's age, the severity of the infection, and nature. Usually, it heals up without any treatment. Sometimes, the children may need antibiotics when the bacterium causes the infection. The doctor waits for 3 days before suggesting any antibiotics or pain-relieving medications. The doctor may recommend ear tubes if a child's disease is not treated with antibiotics. In this case, the doctor inserts a small tube in the child's eardrum. The procedure takes only 10 minutes. When the tube is placed, it allows the air to move towards the middle ear, and ultimately, mucus drainage is possible. This remains for 12 to 18 months. It may fall apart independently, or surgery may be required to remove it. Could otitis media be prevented? Here are some suggestions for prevention that could reduce the risk factor of getting a middle ear infection. Take care to prevent colds and other respiratory diseases. Avoid the explorer of secondhand smoke. Try to breastfeed your baby, as mother's milk has antibodies that resist infection in the child's body. If your child is bottle-fed, uplift his head while providing milk. This position prevents the backward flow of fluid toward the Eustachian tube. Get your children immunized. How much is otitis media? Mostly, an ear infection can't cause long-term issues, but some complications could happen, which may include loss of hearing. In this case, the affected person may temporarily lose hearing or get a sound disturbance such as double or repeated sound. Children may face delayed language development. A child needs the hearing ability to know, understand, and speak language. The muffled hearing can cause problems for a child's speaking ability. Torn eardrum. 5 to 10% of middle ear infected children may get small tears in the eardrum, which could run out by itself. If they do not run out, then the child needs surgery. If the middle ear infection remains untreated, then the infection could spread and reach the backbone of the ear. It could move to the brain or spinal cord and cause meningitis. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.